second presentation, and we're just waiting for those slides to come up and be transferred. And so our second presentation is going to be given by Luis Fernandez Luque, and on the e-health tools can make a key difference to therapy outcomes of growth disorders. Luis.
Thank you, everyone. I just want to check if you hear me, right? Okay, I hope so. So today I'm going to give you an overview of how digital health can actually support growth hormone therapy. Let's start with the disclosures. So the idea for today is to help you to better understand how data and digital solutions can help in the context of growth hormone treatment, including supporting adherence, and also how we can develop and adapt those tools so that we actually help with the compliance to treatment. First of, can I go back? Let me see. Yeah, first of all, I would like to give you an overview of the landscape that we have actually in digital health within the context of pediatrics. As you can see on the left, it has been already quite long time, more than 10 years, that in the context of growth hormone treatment, you have connected injectors that allow transmitting data from the injections so that the clinicians can see it. There are also mobile applications that can help in the diagnosis, for example, some rare conditions using AI, like that app that's called Phase2Gene. And also, people have been working on digital health interventions that leverage connected devices, but also mobile applications. And I will get deeper into one example later on. And we should always remember that there are many mobile applications that parents are using to track the growth of their children with or without having a growth disorder. And actually, we did some years ago with Professor Labarta from Zaragoza, a review of mobile applications. We found actually hundreds. In addition, there are many families that are sharing in social media their experience with growth hormone treatment and also related to the diagnosis of the different conditions. You find that in YouTube, in Reddit, you can find it also in Facebook. And since many families are using those social media channels, there are also some people that have been developing interventions that leverage those social media networks like WeChat, which is similar to WhatsApp, but more popular in Asia. We have a lot of technology, but we always have to think on the patient journey. And this graphic here is from a paper that Professor Dimitri, collaboratively with other people, put together, explaining how different technologies can be used across the entire health journey in the context of growth hormone therapy. We need to think on the early diagnosis, the referrals, initiation to treatment. Then it's very important to sustain the treatment, especially during the adolescence. And also in some cases, there will be additional support needed in the transition to adult care if the therapy is needed for the long term. In that context, all the tools I was mentioning before can be used, and we need to think that some of them are more geared towards the primary care, for example, in the context of diagnosis, and other will be more in the context of a specialized care, but always having the families in the center because they are the ones that they need the support for the self-management. One thing that has been changing quite dramatically in the last few years is that with the more advanced technologies in terms of artificial intelligence and also having access to data, is starting to enable many applications in pediatrics and also including pediatric endocrinology, and in some examples also in growth hormone treatment that leverage the power of data and AI to provide more meaningful solutions to clinicians and patients. If you really like this topic, I strongly suggest you to check that review that was led by Professor Dimitri and Savage, where you can see many of the existing examples and things are about to come. We can categorize them in 3 levels. Many things are being developed to help in the diagnosis. Also, there are examples in the context of management of chronic conditions in pediatrics. And if you have a huge amount of data, sometimes you cannot use traditional statistic approaches to try to infer knowledge. And for that, people are actually also using AI to better understand what is happening in those big data related to pediatrics. I am going to give you some example in the next slide. But before I go to the example, I want to highlight what is unique in pediatrics. When we are dealing with chronic condition in pediatrics, we are not treating only the disease, neither the patient. It's very important to understand the context. And that's why many pediatricians spend a lot of time trying to understand if there is social support, if there are things related to the neighborhood or the environment that you need to put attention into it. Those are called the social determinants of health, which is very important to complement the data that will come already from the patient, whether it's objective injection data that come from a connected device, the basic health data. And the importance of that is that we know that those social determinants of health, things like gender and the age, has an impact in adherence. And also there are some studies that found that diagnosed tend to change across demographic, across ethnicities. So this is something that we need to pay attention. In this slide, you can also see like a social determinants of health is actually regulations that can change from country to country. You may think that that's very difficult to study, the impact in something like growth hormone treatment adherence, but actually it can be done. The Dr. Domenle took advantage of a very large data set of growth hormone treatment injections coming from a connected devices across multiple countries during the context of the COVID-19's lockdowns. And actually, in that paper, it's very interesting to see how those changes in regulation in the social dimension actually has an impact in adherence. Actually, the adherence became better across multiple countries during that period. That gives us an opportunity, those type of techniques, to understand what is happening when things change in the context. And because you can look at the populational level, it's actually a very fast, quick way to get real-world data across large populations, which typically is very difficult, especially for conditions with low prevalence. In another example from Dr. Buman in Finland, they did something similar, but they look into Finland. Finland has quite a lot of good data, not only from the adherence to treatments through those connected devices, but also in the screening. So at the end, they managed to create a database with thousands of patients, and they started to study how social aspects like gender and age actually has an impact in the adherence to treatment. That information that comes from a big data source can help to develop the strategy to tackle why, for example, girls may have different adherence to boys, and how you can actually tailor those interventions to better serve those subpopulations. Now, I want to give you another example that is actually from a study that we ran in the company with the collaboration from the Hospital Miguel Servet, and it was also sponsored, as you can see below there, from a pharma company. In here, what we wanted to do was to put together all the different data sources to be able to provide a more personalized care. So what we did was to collaborate with the clinicians that they had access to objective adherence data through a web portal. So they were able to identify families that they were struggling with poor adherence. Those families, then they were offered of digital interventions to support things related to the self-management, the mental well-being of the parents, and also encouraging them better relationship between the parents and the children. After a period of time, we were able to collect patient-reported outcomes to see what was the effect of the intervention. What we were able to analyze after 3 months was the impact in adherence. More than 70% of the families moved to optimal adherence. That was significant. That's what you can see on the right, but also very important because we collected additional patient-reported outcomes. We were able to understand what was happening, what was changing in those families. We were able to see that they had in the beginning high levels of stress, depression symptoms, and anxiety, and we managed to reduce them dramatically. So basically what we did with those parents was to reduce their anxiety and increase their confidence with the treatment. And that's very important because the moment you change the mental health and the family dynamics, it's actually easier to sustain long-term changes. It's not like a reminder, you're actually enabling the family. That already got published, and this is a very good example of how you can put together technology to try to change the way the practice is done to be able to provide a more personalized care. In that context, we need to think how we can enable more examples like this. First of all, we need to create an ecosystem of value for the families and the clinicians. It's very hard to do this if the informations are in silo and it's never together, because sometimes to better understand what is happening, you need to combine objective data from a connected device with injections and also the mental health from the parents and the clinical data. So if the data is not together, you cannot try to understand what is happening. You will have only a partial vision of it. In pediatrics, we know that often we are lacking data about the family context, social and mental health aspect. That's crucial because it has a direct impact into quality of life and also in the acquisition of self-management behaviors. When we do things like this, we have to be very careful that it's very complex. So sometimes the correlation may not be actually very meaningful. We have to do more robust evaluation, try to observe, replicate different sites, and everything that I have said can never take a proper place, bring value if you don't train the clinicians on how to use those digital tools to better support the families. Even more, a key challenge is that sometimes people are working in digital solution without considering the clinician context, like the VC appointment, the lack of time when clinicians are in front of family. That's something that needs to be considered very carefully whenever you are trying to innovate, integrating a new digital solution. And we have a huge problem across healthcare systems that the health literacy level of the families is very heterogeneous. So if we want to really improve the health outcomes across a population, we need to be aware that there are some families that they will struggle more with technology. And rather than exclude them, we need to provide them with additional support. We need to foster the digital health literacy of those families, especially those with lower socioeconomic status that typically will have more issues with adherence and self-management. And that was everything. Thank you. I will be very happy to take questions now, or you can also send me an email anytime.